Cuts have been taking a toll when it comes to various services and programs. WHAS 11's Charlene Shanklin and chief photojournalist Philip Merle sit down with a member of the Kentuckiana Pride Foundation to discuss concern about the health care in the LGBTQ+ community.
The Kentuckiana Pride Foundation works to educate the community, whether it's on history or the disparities in health care. We wanted to know more about the things the LGBTQAI community are facing that go unnoticed. Pride Foundation Vice President Tim Wayrock says there are a couple of issues people should know.
About health equity, and that's an area that we see certainly marginalized in our community because the funding is one of those big things that where does the money come from? And we see in the political climate today that funding is being cut left and right across federal to state government, which then has a consequential effect down into the grants that are given to just these local community organizations. And so several community organizations, even ourselves, are being impacted.
They say with the current political climate, lives are at risk.
For example, HIV and AIDS, not only just for screening of that and protection of that, but people who are actually on life-saving drugs could be affected by this. And so people can die as a result of these effects that are happening in the politics in the current climate.
The foundation is also looking ahead to ways they can help and to sustain the needs of the community.
That's a big thing that we want to be able to look towards and look to the future and make sure that we are responding to those needs. And some of the things that we're doing is in ourselves, Stephen kind of talked about an endowment. At the end of the year, we're going to launch our very own called the Shine Gala. And the idea is to shine a spotlight really on those people who are leaders in our community.
They hope to use it as a funding platform to cover expenses and to drive money back into the community for scholarships, education, and other essentials. It relieves some of the pressure.
And know that we don't have to have that dependency on really the government entities.
The foundation believes it takes partners in the community, sponsors, and corporations to make this successful, understanding the risk of not having the proper care.
It does truly have life-saving consequences.
For WHAS 11 News, I'm Charlene Shanklin on your side.
And since our interview, the VOA Outreach and Prevention Program announced that their services will end on July 1st, and all federal CDC funding for HIV prevention is on hold indefinitely across the U.S.